Happy Saturday, everyone, and welcome to the Lioness Den. Look, I am so happy that you chose to join us today. We have such a great session for you today. Today, we're going to talk about women's health. And a lot of us go through many different things. And we go to our doctor sometimes, and sometimes we don't. Sometimes we try to sit it out. But there are things going on in our bodies, and we don't know who else is going through it. We are really in an uproar sometimes where I have a pain in my stomach, or they told me I have something, I don't know what to do with it. So today we want to start the conversation about women's health and just dive into some of the things that pertain to us as women. So we're going to start with our opener and then we're going to get right into it. I have a very, very special guest to talk to us today. Welcome to the Lioness. We are back. And without further ado, I will present to some and introduce to other Miss Karen Lee. Hi,
Hello.
Karen.
Hi, how are you?
I'm good. How are you?
I am great.
Guys, this is Karen's first time being with us. So I want you like to put all the hearts up. Welcome Karen to the Lioness Den because we are about to have a really, really serious conversation. But before we start, I want Karen to introduce herself so we can all get to know Karen like I already know Karen. Karen, it's on you.
Hello, everybody. My name is Karen Lee, and I am a registered nurse. I have been a registered nurse for 22 years. I started off in women's health, and I have kind of ended up in education. Education is something that I absolutely positively love. And that's why these topics are really, really something that's very close to my heart. So,
Thank you for coming, Karen. We are just so, happy. I've told you off the air, but I'm telling you on the air, we're so happy that you chose to spend this next 45 minutes to an hour with us, just sharing with us some things that we don't know. So we are happy that you're here. Um, I am actually going to give you the floor to start
okay.
with our first topic, and then I'll just chime in where I can with the little bit that I know.
Sounds good to me. So we're going to start by talking about fibroids. Okay. Um, just to give you all a little bit, again, I've been a nurse for 22 years, but I had fibroids years ago, had no idea that I had fibroids until I probably after I had my second child. And he is now 36 years old. So I really didn't know about fibroids. And one of the things that the doctors had told me at that particular time was if they don't bother you, don't bother them. And that's like, okay, no problem. All right. So I was in my 20s, my childbearing years. So let's talk a little bit about what a fibroid actually is. Okay. Now, fibroids are non cancerous growths of the uterus, and they often appear during your childbearing years. So, there go. We're finding out that I had fibroids and I'm going to relate to myself as well. They were very small at the time, and he was like, oh, they're going to be fine. You'll be fine. They'll probably go away by the time you hit menopause. That was what I was told. Right? Mm-hmm. So uterine fibroids aren't associated with, when you hear them, you say these are little non-cancerous tumors, basically. And people are like, well, can they cause cancer? Most of the time they don't. That's why your doctors kind of just leave them alone and monitor them. Okay. So what actually causes them? So, of course, now let me tell you about medicine. Medicine is a science. So they don't really know what the real reason why we have fibroids or what causes them. Evidence suggests that Multiple factors play into that. Okay. Multiple flat factors. What is that? Research suggests that these factors play a role in the growth of hormones, of these little tumors, non cancerous tumors. Genetics.
Mhm.
Okay. Genetics, growth hormone. Also, culture and race play into that. Okay. What do we mean by culture and race? Okay. You see fibroids more in African American women and Asian women. Now, it's funny because all of over the years when you looked it up, you saw in the literature it talked about African American women and Asian women. All of a sudden, you don't see very much on Asian women. It's just a lot geared toward the African American race. Okay. Um, it talks about stress. Now, I want us to think about this in a way African American women. So, African American women carry a lot of times our families. We don't want to admit that. We don't like to say that, but we do. That's a lot of stress. And that stress is not stress that God intended for women to actually carry by themselves. So our bodies are now reacting to this stress that we're carrying. Okay. So, what are the risk factors? Okay. We already know that you get them a lot of times when during your childbearing years. Okay. Risk factor, age. Older women are at a higher risk of getting fibroids than younger women. Okay. We talked about the African American race. Black women have fibroids at younger ages. Hmm. That's a good research study. Well, why is that? And again, going back to stress, going back to genetics, things like this. Okay. Obesity is a risk
Mhm.
factor. Okay. So, just to explain that a little bit, increased body fat, especially abdominal fat, is able to enhance the risk of uterine fibroids. Hmm. Wow. Okay. Family history of uterine fibroids, high blood pressure, um, no history of pregnancy, vitamin D deficiencies, food additive consumption, pregnancy. The risk decreases with an increased number of pregnancies. So the more pregnancies you have, the less, and that's probably because of hormones too. Okay.
I got my hand
And
up, Karen.
oh yes, ma'am. Hmm.
So you mean to tell me if I had more kids, I have less fibroids?
Look, that's what the literature is saying. That's not a
Oh
good thing to
goodness.
tell folks, though.
I know, I know. I'm like, wait a minute. She's saying if I had more kids, I have less
Hmm.
fibroids. That's interesting.
Hmm. That I found that really interesting tip. So now listen to this: long-term use of oral or injectable contraceptives, hmm and use of soybean milk. Soybean milk is not good for us, not at all. Okay, so now let's talk a little bit. We talked about risk factors, what it was. Let's talk a little bit about symptoms. What are some of the symptoms? Now, I'm going to go back to myself. I had no symptoms, had no idea that I had fibroids. I knew my mom had had a hysterectomy, but I never knew why. Okay. So, one of the things that I notice as far as symptoms is as they they can begin, these fibroids can begin to grow. Okay. So they can begin to grow. Many women have no symptoms. However, they can cause uncomfortable and sometimes painful symptoms such as heavy bleeding or painful periods. So again, for some reason, it was a lot of stress going on, a lot of things happening, and these fibroids that I had began to grow. My uterus got to be the size of if I was 6 months pregnant.
Oh wow.
They can grow that big. And in my nursing, we had women who had fibroids, and the fibroids, as the baby grew, the fibroids grew, and they were really concerned when it was time to deliver the baby because they were afraid that they would cut something on the fibroid and cause the woman to hemorrhage. Okay. So they began to grow. And thus, with it growing in the uterus, it can become very painful. Okay. Anemia. So the other thing was, as I got a little older, what happened was my menstrual cycle got heavier. I never had a problem with my menstrual cycle. You know, all of the women would say, "Oh, I have cramps and I have this." Before I had uterine fibroids, I had no problems at all with pain, cramping. Not even when I had my cycle, I didn't even have cramps. I had to look at
Wow.
that calendar and make sure I knew when I was getting ready to have my cycle. But as they got larger, then what started happening was I started having painful menstrual cycles and I started bleeding. I remember being at work one day and I was just, you know, my norm, my norm. And all of a sudden, I realized that I had came on my cycle, messed up all of them. When I say messed up, my all of my clothes. It was like World War One.
Hmm. Hmm.
And that's the other thing because the menstrual cycle becomes extremely heavy. And women will find that, they do a pad count and they're using several pads and not just one pad, but they have like two pads. It's layered. Okay. This is when the fibroids start to be a major problem. So with all of that bleeding, that causes anemia.
Well, Karen,
Okay.
one of the things that I've seen is not with the anemia, then you become tired.
Hmm.
So I've experienced some of what you talking about because um just a few months ago, I had an extended period,
Hmm. Yep.
and a period much longer than my normal, and I
Hmm.
found myself being so very tired, like I mean, just exhausted, having to take extra iron just to
Yes.
try to do my everyday. And one of the things they said to me is, "Oh, you have fibroids. They're really little." And I didn't understand what they were saying, so I had to call my cousin because he's like a medical code, and he was like, "Oh, they're just telling you there's nothing wrong, but you have fibroids." You know,
Hmm.
which before when I was very young, first starting off, they told me I had fibroids. Then they went away. Now
Hmm.
I am not as young. I'm not gonna say I'm old, not as young.
Hmm.
And they seem to have returned. And so because of that, um, I was like, what's going on? But then once I had that, then you know how and maybe this is I'm getting ready to go into another part, but then you run into where you have the long periods, then you have the no periods starting up, or the every other or every two, or you get sketchy with the period.
Hmm.
But it all started with the fibroid.
Yes. It all starts with the fibroid. Exactly. So then again, like you were saying, you had the anemia and you're tired, okay, because your oxygen level is not that great, okay. Your iron level, and you're taking the iron, and then you're like, okay, something has got to give, okay.
Hmm.
So again, listen to some of the other symptoms,
Okay.
which is exactly what you just said: bleeding between periods, okay, feeling full in the lower abdomen, in your belly. Okay.
Mm-hmm.
Sometimes called pelvic pressure. Hmm. Frequent urination.
Mm.
Okay. Because it's sitting on the bladder. The fibroids, a lot of times, may be sitting on the bladder. Painful if you're married, and this is, I'm speaking to women of God. Hmm. Uh,
We all are
painful.
women of God.
There you go. Amen. Pain during sex. Okay, it becomes very uncomfortable. Low back pain, and then what happens is the women can go into reproductive problems such as infertility, multiple miscarriages, early onset of labor during pregnancy. Okay, and a lot of different other obstetrical problems, such as increased likelihood of C sections, like I was telling you about. So, treatments. Okay. Those were some of the things that you see, some of the symptoms. Treatment of fibroids. Okay. A lot of times, remember I told you the doctors say, if they don't bother you, don't bother them. Okay. Which means, and they can go away and then, and so shrink and then come back. Okay. So, medical related treatments, they can do pain pills. Okay. Birth control pill, that's another thing that they can put you on that will help. IUD is another thing that they would use. Um, a myomectomy. So I had decided that I didn't want to have a hysterectomy because that's like the last thing that they would say. So I decided to get a myomectomy. So the myomectomy is a surgical procedure that they do to remove the fibroids. Okay. And it leaves the healthy tissue and the uterus intact. Okay. So it can preserve the ability to get, if someone is trying to get pregnant or wants to get pregnant, it can lead that ability for them to get pregnant. But here is the risk factor of fibroids. As you said, yours shrunk, went away, they can come back. So I
Yeah.
had a myomectomy. They removed, I think, 20 or so fibroids. And a few years later, they came back.
Wow.
They came back. Hmm. So we have to really, when you're thinking about this, so the last alternative and the last treatment that they use is a hysterectomy. So a lot of women, even if they're past, if they get to menopause, then they say sometimes that because of the decrease in hormonal levels,
Hmm.
then they say, oh, we'll leave it alone, and they may go away, and you may not have a problem with them. Okay, but I want everybody to really think about also stress levels. We as Black women don't think about stress. We can walk around, and I have done it. I have done
Hmm.
it on a regular basis where you're thinking, oh my goodness, okay, I got to make sure that this is done, that's done, my kid is here, my child is there, I have to do this, I have to do that. And this stress is affecting your body,
Yes.
and we don't even see it. We don't even see it. We don't know it. We don't see it. We don't think about it until there's a problem. That's when it is. Okay. So, some factors recommended to treat your fibroids, or how you can do this, what you can do is, again, we got to think about the stress factor. I want us to think about stress, how we eat. What are we feeding our bodies? Long term use of contraception. Okay. I will tell you, let me share this with you all. Um, I just got married, and I decided, I wanted to use some type of contraception. And I was excited I was going to be married, but I had no idea that the increased estrogen levels in the contraception that I was using caused me to have what we called a TIA. And that's
Mm.
considered like a mini stroke.
Wow.
Hmm. And I had no idea what was going on, but I knew something wasn't right. And we couldn't figure out what was going on. So I had the stress, and then I was on this contraception. And it caused me to have a mini stroke. So I need us as women, as dark women, to really think about our health, our diets, stress levels, all of that is very, very important. So that was fibroids. Okay. Um, that was one of the huge things that we as African American women deal with. And
Yeah.
again, one of the things that we all have to think about is genetics. Okay. This is where we need to have these conversations with our moms. Things that we don't think about. You know, mom, oh, okay, mom had a hysterectomy. Why'd you have a hysterectomy? Have those conversations. We don't think about that kind of stuff.
Yeah.
So we'll talk
Definitely.
about all of that good stuff. Uh huh.
And sometimes it's they don't people don't have moms. So a lot of women, now with everything going on, the moms are dying earlier. And
Yes.
so you have a lot of young people who are now older people, their moms are gone. I mean, my mom passed when I was in my late 20s, And
Yeah.
so when I'm getting to these issues and these places where I need to know, hey, what did mommy go through?
Mm-hmm.
Don't really know because we didn't discuss it then. And then with my both of my grandmothers also being gone, it's kind of, well, I don't know. And if you don't take the time to research it for yourself, like what could be going on, then
Mm-hmm.
you're just not you don't know. And then you get to the point where you're scared to find out. So a lot of
Absolutely.
us get stressed because we're afraid to, like, what if? What if? Because if it's in my stomach, it's hard. If it's a fibroid, it could turn into a tumor. Because you just said a fibroid is non-cancerous. Okay, so but I don't know that at first. So when I
Mm-hmm.
got my first diagnosis that said you have fibroids, I'm like, so what could it be? And all of these wonderful words that they add in that we don't understand when they write it up
Mm-hmm.
in our charts and they send you the my chart uh summary, you're like, what does that
Mm-hmm.
mean? So then you have to find somebody to tell you what it means with the big words. That's why it was really important to do this one because so many of our moms are not here and we need to know. And a lot of us are stressed out because we're scared to find out. Really honest. We're scared to find out.
Exactly. Which goes to, we as women have to learn to have these conversations with our children as they're growing up. You know, you only give a child what they understand. I'm not saying throw the big stuff at them, but as they're growing up, we have got to have conversations with our children. We've got to tell them they need to know about our history. They need to know, well, this is what this is. And, don't give them the little, the small things. Oh, they don't need to, I'll tell them later. You don't know if later will happen. And
Yes.
that's super important for us to have those conversations with our kids as they're growing up.
Yep. Yep. Absolutely.
So, the next thing that I want to talk about is polycystic ovarian syndrome, or PCOS. Okay. Now, I've heard of this, but I never really paid it any attention until I started doing my little bit of research for this program. And this condition, PCOS, is a condition marked by infertility, enlarged ovaries, menstrual problems, high levels of male hormone. So I want everybody to understand that as that females, we have testosterone in our bodies in low amounts, as well as estrogen. And men also have testosterone in their bodies as well as estrogen, but in lower amounts. But in this particular process, uh, there is a higher level of male hormones. And that's what causes some of the symptoms like excessive hair on the face and the body, okay? Acne and obesity. Okay. It's one of the most common causes of female infertility. It affects 6 to 12%, and it's as many as 5 million women, okay, of in the US in their reproductive age. Okay. So what's the cause of it? You know, I like to do causes. Okay. The exact cause, here we go, is unknown.
Oh, wow.
Okay. But it's thought to be related to the abnormal hormone levels. Okay. Excessive weight and family history, which are in turn related to insulin resistance. Okay. Yeah. Mm-hmm. So, risk factors. What are the risk factors? Insulin resistance.
Yes.
Okay. It's insulin resistance. That's when their bodies can make insulin, but it can't use it effectively, which causes sugar or glucose to deposit in the blood. Okay. And what happens is it increases the risk for diabetes. Okay. They also have a higher level of androgens, which is male hormones that females also have. So their levels are higher than norm. Okay. And which can stop the eggs from being released, which is your ovulation. Okay. And causes the irregular periods, menstrual periods, the acne. A lot of these women will see thinning hair. Okay. And excessive hair growth in places that they don't want it, like on the face, on the body. Okay. Symptoms. What are some of the symptoms? Okay. So you have missed periods, irregular periods, or very light periods. This is the opposite of fibroids. Okay.
Mm.
You have ovaries that are very large, or they have many cysts. Okay, which are small growths. They have excessive body hair, including on the chest, the stomach, the back. Okay. Weight gain, especially around the abdomen. All right. Acne or oily skin. Male pattern baldness or thinning hair. Infertility. And then they may have dark or thick skin patches on the back of the neck, the armpits, or under the breast. Okay. Mm-hmm. Now, understand this. Whenever you're talking about any type of disease process or anything like that, it's always going to be individualized. So, when you're talking about being individualized, that doesn't mean that you have all of these things. But think about it. What would cause a person to go to the hospital? Oh, I'm trying to have a baby and I can't have a baby.
Yep.
See, there are things that we adapt to that we take as normal when they're not actually normal. I don't come on my cycle that much. It might come on a little bit. It might not come on.
Mm-hmm.
Okay. Um, and then we have all seen people who have a little bit of hair, might have Aunt
Mm-hmm.
Fanny might have a little bit of hair, and you don't think anything about it. She like, oh child, I'm going to get a little wax here,
Yeah.
get
Make
that
little
little
jokes
hair.
about it sometimes.
Exactly, because they're not really thinking that an abnorm is an abnorm. It's a norm. It has become a norm,
Annoying. Yep.
which is one thing that again I want to emphasize. Don't ever think that something, oh, this doesn't mean anything. If something is not normal to you, go and check it out. Don't worry about, oh, the doctor is going to think I'll come again. That's a fallacy. It's better to be safe than sorry. Okay. So, what are some of the complications? Number one, diabetes. Okay. We don't think about that. It says more than half of the women with PCOS develop insulin dependent diabetes by age 40. Some of them develop gestational diabetes. Now, one thing that I learned when I was working in women's health is that when you become pregnant, whatever is inside of you is going to come out then. So
Oh
if you're
wow.
going to have hypertension, you will have pregnancy induced hypertension. If you're going to be a diabetic, you might have gestational diabetes. Okay. So now with gestational diabetes, you have something very that could be potentially dangerous to the baby because diabetic mommies can have your babies. They have what they call macrosomial babies. And these are very, very large babies.
Oh wow.
Hmm. So that can be an issue if it comes out when the person is pregnant and they have gestational diabetes. Heart disease. Okay. It says women with PCOS are at a higher risk of having heart disease and at a higher risk as they progress in age of having heart disease. High blood pressure. Of course, high blood pressure can damage the heart, the brain, and the kidneys.
Mm.
Okay. So now we are looking at these things that we think are not that big a deal that can cause other things that can become a big deal.
Yes, definitely.
They have a problem with their cholesterol, okay, which also could cause a risk for heart disease, sleep apnea. Okay, what does that mean? That's when you snore and you think, okay, I snore a little bit. Okay, you know what that snoring is? Sleep apnea means you stop breathing while you're sleeping. Mm-hmm. A stroke, and these are just some things. Oh, and here's another thing that I found quite interesting. Women with PCOS, it has also linked to depression and anxiety.
Oh wow.
They're not sure what the connection is, but it seems to be linked to that. Okay. Um, we talked about a couple of the complications. So, can this be treated? It says it cannot be cured. But what needs to happen is the symptoms can be managed.
Okay.
Okay. We talked about the complications, and you and I were kind of talking about some of the complications. And so I looked it up. So they said that some of the complications with the women is that, while they're pregnant, having the large babies, okay,
Hmm.
um, and those babies will more than likely wind up in the NICU, okay, which is the neonate intensive care unit, okay. They can wind up either in the NICU or it says or dying before they're actually ready to be born, dying in utero, okay. The other thing is that women with PCOS can have children with autism. So I kind of looked at that and I was like, so what's up with that? And that's because of elevated levels of prenatal testosterone may increase the risk of this.
Oh
So
wow.
not only does mom have more testosterone than she's supposed to. She's producing it, and so is baby. And this is one of the things, one of the reasons why they say that the baby can have autism um, after they're born.
That's
So go ahead.
I'm just saying it's interesting. I have friends who have PCOS, and and I even have siblings who have PCOS, and it's just interesting because all of the things that you just described, I know that they either have those symptoms
Mm-hmm.
or or they have most of those symptoms. And then I have a girlfriend who her daughter is autistic, and she had PCOS. They told her she would never be able to have a baby, but then she had a baby, and they told her, well, maybe it's hereditary, or maybe it's a side effect of the PCOS, but they never really narrowed it down. And it's kind of interesting because um, what I see a lot of times, especially with friends, is if one of the siblings have PCOS, the other one may have it too, and then they both have children, and all of their kids are autistic, or some of their children are autistic, and then
Wow.
they're trying to figure out, well, is this hereditary or what?
Mm-hmm.
But it could just be the side effects of them having PCOS. It's
Mm-hmm.
very interesting, very
And a lot,
interesting.
it, as you can see, this is a science. So
Hmm.
they're still doing research on why this is happening, but they're looking at the levels of the hormonal levels. So that seems to be what everything is centered around.
Yeah,
And so I really, this is fascinating. So I really need to do a little bit more research on this because, again, I've heard of it, but they don't talk a whole lot about it.
yeah. Well, and a lot of women who have it, Karen, and just because I know them, they won't talk about it. I hear people say, "Well, I never really wanted kids anyway," and I know that they did because growing up, we all grew up together, and we talked about when we'll have kids. Now, the funny part is, or not funny part, I was one of those who, when I was younger, didn't really want to have a kid, and
Hmm.
I ended up having a kid. And then some of my friends and family who said they wanted to have they grew up and found out they had PCOS and they don't have kids. And so, it's one of those things that you go, oh, okay, now just with you reading that, I understand, a little bit more, because the depression is a big thing too, because a lot of my friends, they deal with really bad, like bouts of depression, and they don't
Hmm.
know what's going on or why. They just know, like, I'm just here right now, and I don't know, you know. And then they have diabetes. Most of them have diabetes, and they gain weight, and they try to lose weight, and the
Hmm.
doctors put them on all of this diabetes medicine that causes them to lose
Hmm.
weight, but it comes right back.
Right.
So they're working through this roller coaster.
Hmm.
Basically, it sounds like a roller coaster that they're working through, trying to maintain just what we feel sometimes is a regular life.
Exactly. Exactly. And the last thing that I wanted to talk about, along with these subjects, is menopause. Uh, menopause. All right.
All right.
So, menopause. What is it? Menopause is the time of life when a woman's ovaries stop producing hormones and the menstrual period stops. Okay. Natural menopause usually occurs around 50. But I need to let you know now. Can you see me? Because it's a little dark up in here. And sometimes, you
I
get
can
up in
see you,
your little,
sis. I
oh,
can see you.
okay, good. All right. But it normally starts around age 50. Now, let me say this. Again, this is an individual thing. And this is where we need to have our conversations with our moms. Because one of the biggest things that they told me with menopause is ask your mom when she started having menopause. Okay, my mom had a hysterectomy. Okay, so what does that mean for me? Okay, so I'm going to tell you that it's an individual thing. I've heard of some women starting menopause as early as 30, 35 years old. So it just will, it's a hereditary type of thing. And what it's marked as is you have not had your period, your menstrual cycle for at least 12 months. Now, I have a friend that she didn't have her menstrual cycle for 12 months. Hadn't, it was like, okay, I guess I'm in menopause. And then probably on the 15th month, it said, hey girl.
Got you? Not
And I
really.
mean, when it came in on fire. She was like in so much pain. She called me screaming on the phone in pain. So again, it just varies. It varies. So there are different stages with menopause, and I'm gonna try to go through this real quick. Okay.
Okay.
So we got premenopause. Okay. And the premenopause is doing this is when women are having their regular menstrual cycles. It's childbearing time, um, no noticeable symptoms of menopause. So we just living life and enjoying life and having kids and all of that. Then there is perimenopause. Perimenopause is the transitional stage between pre and meno. The pre and the menopause, okay? And this is around in the 40s, and this is when you start seeing little signs and symptoms, okay? You kind of get the irregular cycles, frequent changes in your mood where everybody's like, "Oh Lord, what's wrong with her?" Hot flashes,
Ooh,
okay?
Jesus.
Yeah. There are some that have headaches, vaginal dryness, brain fog. Mm, okay. And achy joints and muscles. So now, when you get into the menopausal stage, that's again, it can be anywhere between 30s and 60s. Okay. And it can go on. I know people whose cycles go on past that age. I know people who've had children past that age. Lord Jesus. Hallelujah. Hallelujah. But again, they have to be in menopause. You have to have not had your period for 12 consecutive months. Okay. And this is when you are in full fledged menopause. Okay. And then you have your postmenopause stage. And that's when, this is when the women decide if they want to take, like in menopause, do I want to take something for it? Now, remember I told you all I had a TIA.
Mhm.
I can never take anything with estrogen. Therefore, I can never take any hormone replacement ever,
Oh, wow.
because it could cause me to have a full blown stroke.
Okay.
Okay. So I want, as women, a lot of times African American females choose to just, we just go through the menopause. We just be hot. It's cold outside and we got sweat running down and we like,
Yes, ma'am.
you
Yes,
all
ma'am.
right?
Yes,
Yep,
ma'am.
girl, I'm good. I'm
I'm gonna
having my
make it.
own personal summer.
That's what I'm
And
saying.
that's fine. That's fine. A lot of African American women choose not to have hormonal replacement. We do. We just deal with the different symptoms and go on about life. But you go through a lot of different stages with this, but it can be treated. It can be treated with non-hormonal, like we just kind of go to, a lot of folk go to the natural medicine store, the health food store, and we go and pick up our black cohosh and things like that that's supposed to help different things. Hormonal replacement is not a necessity. Understand that. You have to know your body, because again, you're putting the estrogen back in and it can cause some other issues. So that was just to touch on three different things that us as women go through. I tried to kind of go over everything and tell you what it was and risk factors. Here's how I want to end this. How I would like to end it. We have to have those conversations again with our children, with our daughters especially. Women to women, talking to our daughters about things like your menstrual cycle and irregularities and things that we don't want to talk about. I can't have a child. You would be surprised at how many people go through what you're going through and they just are so embarrassed. They don't want to talk about it. You are never alone. The word of God says there's nothing new under the sun. So understand, God may be making you open it, having you say something to someone, and then you say, yeah, I've been going through that as well. Also, make sure that you are continuously going to your doctor. Anything that don't make an abnorm your norm.
Yeah,
That's
absolutely.
important. We kind of blow things off, and it's not good because sometimes you blow them off until it's the very you're in a stage where you could have dealt with a certain issue
Yep.
and you did it, and now it has so blown out of proportion that now you can't deal with it. So God gives us wisdom to do the things that we need to do.
Wow, Karen. That was really like so good. You gave us so much information. Oh my goodness. When we talked about this offline, I had thoughts in my head already about, why I wanted to do this. And I have to tell you that everything that I was thinking you covered.
Oh, wonderful.
So
But
I
God be the
so
glory.
appreciate that because one of the major things for us as women is because we're so used to carrying the weight, we throw ourselves to the back burner. And by the
Yep,
time we take the time to go and find out what's going on, it's way further than it needed to be. And
exactly.
so, guys, I hope you are really paying attention to this today because a lot of us sit and suffer in silence. And there are things that we can do. Um, Menopause ain't no joke. Even perimenopause is no joke. When the hot
Mm.
flashes start, trust, you don't have to be 60 years old to get a hot flash. Let me be clear with you.
Exactly.
Sometimes I get hot flashes. And I'm not 60, y'all. But sometimes I get hot flashes. To be all,
Hmm.
you get hot flashes, you break out into these sweats. But whatever you're going through, you're not a doctor. You don't really know. Just go get checked out. It's okay. We have to get our mammograms. I want to say these things because these are the things that we say we can, as women, we can let it go and we'll get back to it. But we need our mammograms. We need our pap smears every year. We need our regular physicals every year. We need to do all of these things. Karen, am I missing any of the women's appointments we should have?
No, those are the ones that we needed. We need to go to our
We
annuals.
really
And can I
do.
say one more thing?
Yes, ma'am.
Self care is much more than getting your hair and your nails done.
Yes,
Self
ma'am.
care is we take care of everybody else except for ourselves.
Yep.
Self care is going to those appointments that you need to make. Don't put them off. Don't put them off.
Yep. Your nails can look good and your body could be going through some major, major things while your nails and your hair are like perfect.
Absolutely.
So while we're
Absolutely.
while we're taking care of ourselves, let's go to the major parts of taking care of ourselves, and that is making sure that these temples that we have are kept up. Sometimes, and I'm a culprit of one of the major self cares a lot of us as women don't do is exercise because we have to take care of the kids. We're working, we're making dinner, all of these things, and we just can't find the time. But that's a part of self care and also a part of holding off some of these things that are coming for us like gangbusters.
Exactly. Exactly.
Karen, we're like 50 minutes in already. Isn't that
Okay.
amazing?
I know.
It don't seem like it's been that long. I say that
It
on
really
every
doesn't.
broadcast, but it doesn't seem like we've been on here for 50 minutes. But we're 50 minutes in. Um, we're about to end, but before we end, please give us some inspiration as we leave this session.
Okay, my inspiration to you all is understanding this. Once I understood that I was not just a child of God, but that God individually loved me. He loves every hair. He knows every hair on your head. Every hair. That's intimate. That is intimate. Understand that you are worthy. You are worth something. And when you're worth something to the Most High God, then you're worth something. The word says, if God be for us, who can be against us? You can't be against yourself. Love yourself. Take care of yourself. And that way you can take care of those around you. Have a wonderful, wonderful rest of the day. And remember that God loves you and we do too.
You do. Thank you, Karen. Oh my goodness, guys. It is Women's History Month, but we wanted to cover this month by talking about women's health. And so as we remember those who've gone before us, like Maya Angelou, Ida B. Wells, Harriet Tubman, Rosa Parks, let's remember ourselves that we have a history we're going to leave for our children, our nieces, our nephews, our family. Somebody's going to read our book one day, and let's leave them something good to read about. We will see you next time on the Lioness Den. We'll see you next third Saturday with something great. By the way, we are in the midst of a financial workshop today. So if you're watching right now and you want to join the financial workshop, go to our Linus Den page, click on the link, hurry up and fill out a form. And as soon as we see it, we'll send you the link. We love you all. God bless you and have a great Saturday. Bye.
Bye.